So Dr. Sharma, tell us what we're looking at here.
So this is an example of the bony matrix in osteoporosis. We're looking here at the joint of the hip and specifically the femur. And I'm not sure if you can tell looking in closely that there's a porous bone. Just like you said, osteoporosis means literally porous bone. And what happens in that situation is when bones become porous, they become more fragile, they're more weak, and they are easily susceptible to fracture. And that's really what one of our biggest concerns is.
But we see this is the femur, but it can also happen in the spine. Is this true?
Yes, this is correct. It can occur in the spine. This image is, of course, of the femur, but it does affect the main skeletal, and we do worry about the hip and the spine more so than the rest.
So how does someone get osteoporosis? Is this more of an age factor? Does it happen to, let's say, women more than men?
So the development of osteoporosis is actually somewhat multifactorial. Okay. So what I usually recommend is thinking about the bone as living tissue. And so the bones are always active, they're developing, and they're being destroyed. And so there are a lot of different reasons that can disrupt that balance. Certainly minerals that you need, calcium, vitamin D, are important to help develop bone, but certainly certain medications such as steroids can increase the deterioration of the bone. And so when we see a imbalance where there is more loss of bone than the development of bone, that's when we really see the development of osteoporosis.
And they call it a silent disease. Is this because you're not aware that you're losing that balance in the bones?
So certainly a silent disease is a great way of describing this condition. Most of the time, a person won't know that they actually have osteoporosis until they have their first fracture. Wow. And so certainly we don't want to let it get to that point. As I mentioned earlier, prevention is very important. It's something that I believe strongly in. And so having that annual exam with your primary care physician, being to discuss with screening what risks are there, can help identify a condition that like this is silent before it becomes a problem.